Hello, everyone, and welcome back to the Outcomes Rocket. I'm so excited you tuned in to another episode of our podcast. I have the privilege of hosting Lindsay Arnold Sugden. She is the CEO of Saul Mental Health. Lindsay, I'm excited to have you on the podcast. Thanks for making the time to be with us.
Thank you for having me, Saul. It's a real pleasure to speak with you. I'm a fan of the podcast, and I'm excited for this conversation today.
Likewise. So look, before we get started, Lindsay, I'd love to just ask you a little bit about your background and also about Saul. Tell us about everything.
Absolutely. So a little bit about me. I think it's always fun to think back on the journey of how we get to where we are. And for me, that journey really has to do with influential people in my life. So I am the daughter of a school nurse. I am the granddaughter of physicians, and I am the childhood best friend of Molly. And Molly had a serious chronic disease that ultimately took her life when we were both in our 30s. All of these role models played a really big part in shaping the person that I am today and my choice to be a contributor in the healthcare field. I have to start with my mom. As a school nurse, she also chose to write grants to turn her school-based healthcare clinics into community clinics for the under and uninsured. And so what I learned from her is, how do you create exponential impact with finite resources? If a 3-room high school-based healthcare clinic that is designed to treat kids with stomach aches could actually transform the healthcare of an entire community, then what else is possible? My grandfather taught me that medicine is a very noble profession and that longitudinal relationships between physicians and their patients can be transformative for both parties, that relationship is sacred, it is paramount, and it is definitive for both identities. And Molly really taught me over the course of her lifetime that patients have to advocate way too hard to not get lost in our system. And she taught me how patients should be seen and heard and cared for, and how poor patient experience and rushed care can devastate overall health and ultimately take lives. So I loved, in preparing for this podcast, just the moment to think about the people that stand behind me and hopefully the people that stand in front of me that help me get to this point where I get to have the privilege of working with wonderful people every day to transform our healthcare system, and with the hopes that the people that I have the privilege of working with today and in the future get to continue to do the same.
That's great. No, I really appreciate that story, Lindsay. I think this gives us an opportunity to really understand what Soul Mental Health does. Talk to us about that.
Yeah. What we do. So Soul Mental Health is a local, clinically excellent outpatient mental health care practice. We have a strong collaborative team of therapists and psychiatric clinicians who support a very broad spectrum of need in our communities. So we think of ourselves as the front doors to mental health care in each of the communities that we choose to serve. Today, we are in Colorado, New York, Washington, D.C., Maryland, and Virginia, and we continue to grow. And we deliver care both in person and virtually to adults, children, adolescents, and couples. We help people get better, and we help them cope more effectively in the world. So this is true whether we're treating a patient with an acute or complex disease like bipolar disorder, or a patient with stress-induced anxiety disorder related to burnout at work. So we are here with a very broad bench of talent, very deep in the communities that we serve, to be the first place that people can come for support, and hopefully that we can carry them through their longitudinal care journey related to their mental health needs.
Thanks, Lindsay. And what would you say? There's a lot of challenges, of course, in access, in affordability in this mental health space. But what would you say is the big pain point you guys help solve differently?
Well, one of the things that we think about every day, and there's many ways that we put the puzzle pieces together in order to do this, is first and foremost, how do we drive value to the system? So there are many people in that system. There are many stakeholders in that system. But ultimately, we are focused on ensuring that we are continually raising the bar for what excellence in mental health care looks like, what consumers need from us, and how we respond to that need. But the way that we do that is by thinking about value in really three different buckets. And then maybe afterwards, Saul, I can talk about the characteristics that define Saul. So the big picture related to value is that we know that people with and undertreated behavioral health conditions are driving billions of dollars of cost into the healthcare system every single year. And last year, the Cigna Group released a study that looked at their own claims through Evernorth and shared that rising levels of anxiety in this particular case were contributing to $14 billion in excess spend in the healthcare system based on these comorbid behavioral health conditions. So they found that 14% of the insured population was driving 27% of cost. That 14%, I'm sorry, was diagnosed with an anxiety disorder by a mental health professional. And those 14% of people were driving 2x the amount of cost that you would expect from them. And what's most important, of course, is that the cost is not coming from the cost of the behavioral health services. The cost is coming from other medical expenses in the system. So
the downstream
impact. As I reflect on my career, prior to being the CEO of Soul Mental Health, I was on the executive team at Oak Street Health, and therefore was working to deliver primary care in a comprehensive format to adults on Medicare. And we knew very well, because we were in a fully value-based care arrangement, taking full risk on our patients, that those with a comorbid behavioral health condition were driving 5 to 6 times more cost into the system. And that if we could do the right things to care for that Medicare patient, we had the opportunity to really reduce cost out of the system in the form of hospitalizations and other high cost settings of care. Now that I am in mental health care, and most of our population, our patient population today, is commercially insured, back to that Cigna Group study, we know that a commercially insured patient is driving 2 to 3 times more cost into the system, again, because of the downstream impacts of having a mental health condition on top of other things that manifest. And if that goes untreated, by the time folks get to Medicare age, they're driving 5 to 6 more times cost into the system. So I've had the privilege of getting to see that problem at multiple points in the age spectrum. And we at Soul are very focused on ensuring that we are creating affordable, ready access to great mental health care, where if we can support people in that moment of need, hopefully we can be a key part of preventing unnecessary costs from hitting the system. So that's one way that we think about value. Another way that we think about value is that we want to provide value to other providers in the healthcare system. So having been in primary care for many years, we know that primary care docs are experiencing burnout in record numbers, right? And we are seeing a shortage of physicians in the same way that we're seeing a shortage of providers across many specialties. A big part of that burnout factor for primary care doctors has to do with increasing scope of practice demands on them, the increasing rate at which patients are presenting in their exam room with really complex behavioral health care needs, and the fact that they need to move on to the next patient and don't have the time to necessarily deliver the kind of behavioral health support that patient needs. They need a partner that is clinically rigorous, that is available to support their patients the same or next day, where they can turn and know that most patients will have the opportunity for it to be affordable because the practice is a network. And we do a lot of work to connect ourselves with the broader healthcare ecosystem of providers to make sure that we can be their easy button. They are trying all day, every day to do the right thing for patients and to do it as efficiently as possible. And many behavioral health conditions are beyond their scope of practice, and they need a really strong partner that is not siloed and not fragmented, and is easily accessible and ready to share notes back with them and coordinate care in an effective way. So those are a few of the ways that we're really looking to drive value into the system, in addition to all the good stuff we know about employees who have a mental health condition are struggling to perform at work. We all know that, right? Whenever we have a moment in our lives where we're feeling dysregulated, it's difficult to show up engaged at work. It's difficult to be as productive as you want to be. It's difficult to be as engaged in your family dynamic as you would hope to be. And so there's many other layers here as well around the health of the employers in the communities that we serve, through the health of our community members, who, again, we're really privileged to get to take care of their mental health care needs.
Thanks, Lindsay. So mainly focused on commercial, right? You guys are focused on the commercial segment. How much of what you do is focused on education? You don't know what you don't know, whether it be a provider or an employer or even an employee.
Yeah. So when you wake up in the morning and you have a scary rash on your body, you have two options, right? Go to the primary care doc or go to the dermatologist.
Yep.
Know what you need to do. As a citizen of this country, if I am struggling to find the energy to get out of bed in the morning, or the energy to brush my son's hair, or
to go to work,
right? Any of those things, I'm not really sure what's going on. I just know that things are not right.
Yeah.
So one of the core principles at Soul is that we have a responsibility to embrace and welcome and educate patients and make sure that they have the right mechanism of getting into the right type of care, right? It is very scary to just not feel like yourself. And usually when a person is reaching out to us or any mental health care practice for help, they've usually hit a really bad spot, right? It's been getting worse and worse.
Like they've let it linger too long.
And they are now in crisis. I literally physically couldn't get out of bed this morning, and I realized that I need help. So the ability to educate people about what is happening in their brains and in their bodies that is contributing to that condition, and offering many different specialties under one roof. Remember that we offer therapy and psychiatry and continue to consider other modalities of care is very important to making sure that a patient need not come to us for one thing, ping back out into the system, and have the other thing that they need never happen, right? Because that in and of itself takes a huge amount of energy at a time that you're struggling generally to find your way.
You guys do testing as well?
We do some testing. Yes, we
Okay,
do.
cool.
And also, Saul, just to mention, we are predominantly commercial today. We also see Medicare patients.
Got it. I think of them as commercial too. I don't know about you. Like they go there. I think of Medicare as commercial too. Because the plans are managing them anyway. It looks like, but anyway, no, I get you though. Good distinction, and thank you. But anyway, you were going on. Yeah.
The other thing I want to mention about education, though, is we believe very strongly that mental health providers and clinicians should be employed in a W-2 construct. That is our approach.
Tell me more.
What is different about a W-2 construct than a 1099 construct, which is very common in mental health care today, is that you have a different level of engagement and collaboration in a contractor construct than you do in a W-2 construct. So we think, as I talked about before, we not only are focused on being the partner of choice to providers in our communities, but we also want to ensure that we are collaborating internally in the interest of the patient, right? So we are a multi-specialty practice, and everyone at Soul is employed by Soul. And through that employment structure, we're able to reinforce all of the qualities that are so important to delivering great care. Quality metrics, collaboration between our clinicians, and then back to the point on education, one of the key differentiators for us is that every single clinician at Soul participates in something called supervision. Supervision is a very important part of collaborative practice in mental health care. And it means that tricky cases are constantly getting reviewed in partnership with other clinicians to try to unlock the next option in caring for that patient as they are on their healing journey. That happens every single week at Soul in the context of both groups and individuals. who are under supervision, meaning that whether you're a licensed clinician or you're still in the process of getting your final licensure, you are being supervised and you are in case review with another clinician that allows you to really work at top of license and ensures that we're continually on the forefront of evidence-based care for our patients.
I think that's great. And from a business model standpoint, Lindsay, I agree with you wholeheartedly. The commitment and level of investment of a person when they're a W-2 versus a 1099 is so much different. We see this in our business. Like, we have felt it. So when you started talking about that, I was like, yes, so spot on.
It is generally true, right? Regardless of industry, that you're going to have a different level
100%.
of engagement and commitment and alignment with the mission. At Soul, our mission is to redefine what's possible in mental health care, which means every single day we're trying to be better and do better by patients in the system. That takes a lot of commitment from someone, and it's a lot to ask from a contractor, right?
Totally.
Like folks who elect to be a part of our organization, who we are so lucky to have on our team, our talented clinicians and their support crew, are invested in that mission every single day and invested in the effort that it takes to be better every day.
Yeah. And I will say, while it's getting better, standardization in mental health is still behind. And when you have this type of alignment and you're setting standards as an organization, this is all great. So in my mind, folks, huge differentiator that Soul Mental Health has here in their model. Definitely something that we should be thinking about and considering. Lindsay, this is fantastic. I know we're out of time here. If you wanted to leave our listeners and viewers with a call to action and the best place they could reach out to you and your team, what would you say and where should they go?
How are we done already, Saul? Gosh, we just got started. This is
I
fun.
know, right?
So much more to talk about.
I know. Well, let's think about doing a part 2. How about that? Let's think about doing a part 2.
So I'd say first and foremost, the important thing that I want to share about Soul Mental Health is that we are focused deeply on doing the right thing for our teammates, who are called soulmates at Soul, and our patients, and how we create better outcomes, better experiences, and a stronger clinician-patient relationship. We didn't even get into technology today, but we are a human-driven company that is AI powered, and that helps us on the back end. But ultimately, mental health care is about human connection. It's about ensuring that you are meeting patients where they are. We didn't have a chance to talk about this, but one of the core differentiators for Soul is that a patient can see their clinician either in person or virtually to ensure that they adhere to their treatment journey together. And so much more of the population is demanding in-person human connection, particularly in this form of healthcare. And we're there in our brick and mortar beautiful care centers to enable that. We are continuing to grow. We are looking to both continue to go deeper in the markets where we are and continue to expand beyond that. And we welcome your listeners, all reaching out to us, who are where our mission and our message resonates to them, whether they are a clinician looking to work in a different forum or a patient who is thinking that they need assistance, right? Or need to make a change. And we're ready to embrace them. Folks can continue to learn about Soul Mental Health by visiting our website, by following us on LinkedIn, on social media. We try to be anywhere that we can be helpful to patients who, again, are coming into that moment where we need to actively reach out to them, a welcoming hand, and support their transition into a supportive environment where they can heal and get back on their feet and cope effectively with whatever condition they're facing. I appreciate the chance to talk to you about Soul Mental Health today, Saul. Thank you so much for having us.
Oh, Lindsay, my pleasure. Thank you for the work that you're doing. It's necessary. We are faced with a crisis in access and affordability, and we really need more solutions like yours, like Soul Mental Health, to take care of this challenge that we have in mental health in our country. So I want to thank you and your team for the outstanding work that you do. I want to wish you success as you guys continue to expand, and I want to reinforce your call to action For everybody out there, whether you be a clinician or a patient, looking for more or looking for better, check out the show notes. We'll leave all the ways that Lindsay left to get in touch with her and the team at Soul Mental Health. If something resonated, share it with your friends, share it with your colleagues, because that's how the word gets out. Don't let it just sit there with yourself. Take action on it. Thanks for tuning in. And Lindsay, thank you so much for making the time to be with us.
Thank you, Saul. I really appreciate it.